Hey, good afternoon. Welcome to my channel. Welcome back to my channel if you have been here before. So, hey, I've been making out a potential plan to get my adult child with a mental health issue to consider switching medications. He's currently taking a monthly injectable, and I would kind of like for him to try Cobenfy. So his background information, he's been on probation, and that is probably the only reason why he is currently taking the injectable. However, the probation is ending in a few short months, and I am trying to prepare for that as much as you can prepare for it. So my question is, will he continue to take medication once his probation ends? If history repeats itself, probably not. One, because he is probably in denial about his illness, and then also the injectable medication that he takes has some pretty substantial side effects. So that being said, I'm hoping that he'll try Cobenfy because reportedly it's effective and it has fewer side effects. So the first thing I did was I went to ChatGTP. I forgot the exact question that I asked, but ChatGTP gave me a list of psychiatrists in my zip code that may prescribe Cobenfy. Currently, my loved one goes to a healthcare facility and he gets his injection there. I've had very little contact with these people. In the beginning, like 5 years ago when he first started going there regularly, I did have a discussion with not only the psychiatrist, but also the social worker. The social worker and I actually had a pretty good rapport. She couldn't share, my loved one's information with me because of HIPAA, but I could share information with her. So I could just call her and we would have discussions with me providing her some honest information and what I was seeing, from interacting with my son. Unfortunately, that social worker is no longer at that agency. My loved one is dealing with a different social worker, and me and this person do not have good rapport. So honestly, if my loved one wanted to try Cobenfy, they could actually engage with the people at this agency. That's possible. I don't know, but that is a possibility. But I don't know that. So that being the case, I contacted some people on the list that ChatGTP provided. And unfortunately, a lot of those people on the list of those institutions, they deal with certain mental health issues, but schizophrenia is not one of them. So at some point I ended up on ZocDoc. Don't know if you're familiar with it, but it's ZocDoc. And the way ZocDoc works, you put in your issue, like what do you want to see the doctor for? And you put in your zip code and of course your insurance information, and then ZocDoc provides you with a list of people that can address the issue that you need to get addressed. So I do want to point out a couple of things that you may already know, but I'm going to say this anyway. So a licensed psychiatry can prescribe Cobenfy, but since Cobenfy is a new medication, some psychiatrists are just not even familiar with it. But I do want you to keep in mind that Cobenfy is not a antipsychotic and it's not a controlled substance. So that could be a factor in whether or not the person that you contact, the therapist or psychiatrist or whatever, can prescribe the medication. But it's also my understanding that therapists and psychologists generally cannot prescribe medication. My daughter-in-law is a therapist, and I asked my other son if she was familiar with Cobenfy, and he said that she was not because she does not prescribe medication. So anyway, I did go to ZocDoc, and two things surprised me from ZocDoc. One, they had a whole list, a long list of psychiatrists who do treat schizophrenia. And then the other thing that surprised me is like the large majority of them do telehealth. And that could also come in handy if trying to get your loved one to actually go with you on a doctor's visit. Telehealth may actually be workable. So I did use the contact information. I reached out to multiple doctors that I found on ZocDoc, and I'm going to read you the response that I got from one of them. One of them said that finding the right medication with a better balance of effectiveness and tolerability is very important. This doctor said they are familiar with Cobenfy and they will prescribe it when clinically appropriate after a full psychiatric evaluation and a discussion of medical history, symptoms, prior responses to medication, and of course they want to know about your insurance coverage. So, and they told me feel free to contact them to make an appointment. So I thought that was a pretty good answer. I like the fact that they are saying that they will do a full psychiatric evaluation and then go from there. So another thing that I did before I would make an appointment. First of all, before I make an appointment, I have to discuss this with my son. But my son, who's married to the therapist, he also recommended that I go on Reddit and just read the reviews that people may have on Reddit regarding Cobenfy. And I did that. I didn't see a whole lot. I saw 11 reviews, and this is what some of them said. Of the 11, some people said they felt like it has been a wonder drug for them. However, there were, of the 11 reviews I saw, there were multiple reviewers that said that Cobenfy gave them some digestive issues, and some even went so far as to say that after a while they couldn't deal with the digestive issues and they gave up. They gave up on taking Cobenfy. So, with that in mind, the next thing I need to do, the next thing I needed to do was to have a discussion with my son about what are your plans after your probation ends, and are you willing to try Cobenfy. I did recently have that discussion with him, and I'm going to talk about it on the next video. So stay tuned. And until the next time, you guys have a great weekend, and I'll see you on the next video.